power grid. Well, that's not concerning.
No.
That's fine. I mean, somebody explained it to me as, Bill Gates has this new semiconductor or something like that that's like unhackable, but he only wants China to be the one building it because of the labor. Like, so it's not the labor in like Cambodia wouldn't be good or Vietnam or Indonesia. I listen, I get the American labor is probably too expensive, and I understand that. Also, on a separate note, why are people so trusting of Bill Gates on everything?
He's so smart. He looks smart.
Oh, my God. Everything. It doesn't matter. Oh, Bill Gates wants to do it, obviously. Like, what? No. Let's not do that. I'm like, it does great work on vaccines. Yeah, go check out the carnage in Africa from the vaccine trials of the Bill and Melinda Gates.
I mean, you don't think it's a good idea for him to own all the farmland in the country?
I mean, what would be at all concerning about that?
I don't know. Food.
Yeah, no, he just said no more beef. We all should be eating synthesized beef. That seems natural.
Yeah.
That'll be healthy. Don't worry about a thing. Well, yeah, let's just blindly, Bill Gates wants to do it. Oh, cool. Never mind.
Well,
why don't you lead with that?
No. Let's move away, kind of pseudo Bill Gates, and talk a little bit about COVID here. We are seeing a massive drop in cases all over the country, even all the world. So much so that Johns Hopkins professor has come out and claimed that the U.S. is going to reach herd immunity by April. In large part, he's kind of done some of his own math where he did, I think his math was something like 15% vaccination, which maybe it's a little bit less than that, combined with his assertion, I think, was like 34% of people had already had it, plus T-cell immunity, and brought him, he thinks that, we're all going to be herd immunity levels here in 6 weeks. What sayeth you, Dr. Hussong?
Probably. Unsurprisingly, as predicted by all available data. What do you want me to say?
Yeah, I don't know. Like I said, I hope they're right, I guess. I hope he's right. I hope that
it's not guaranteed.
With that, not only just being right, though, I hope that we start relaxing some of these rules with this. It doesn't really do us any good if we're all herd immunity and we're still masked up and staying 6 feet away, and there's no schools and there's no businesses, there's no nothing. So hopefully this is just another kicking opening of the door for us to actually get our moving again. We are way past time for us to be moving. And like I said, if this serves as some kind of catalyst to get that, fine by it. But it's encouraging to hear. I saw a little bit of pushback on it, saying he doesn't really know what he's talking about. But he's a professor at Johns Hopkins. I'm sure he's got some information. He's not just randomly throwing it out there at us. So
he's not Bill Gates.
No.
So automatically, like, two demerits.
Do you think he wears glasses?
I just looked at his picture a few minutes ago. I don't think so.
Okay.
But I can't remember.
But encouraging, right?
Yeah, listen, this is the stupidity of the discussion that we always have around COVID is like, well, maybe if we get to herd immunity, we can lift the restrictions. No, we should lift the restrictions right now. You want to know how I know that? We started wearing masks a year ago, 10 months ago. New York State has been compliant with mask mandates over 90%. Over 90% of the people always wear a mask in public. And even think about your day-to-day life. I go out a fair amount. I wear a mask. I know how stupid it is, but I wear it anyway, and that's fine. Do you know how many times, literally since, let's go with June of last year, you want to know how many people I have seen inside of a store or anywhere else
outside of present company included?
Well, I haven't seen you in public without a mask on. I've seen you here.
All summer.
All summer, but where were you going? Oh, when you were tending bar.
I was working.
When you were working without a mask. Yes, that's fine. All right.
I said minus present company included.
Minus present company, but everywhere except a private country club. Generally public available areas. I don't see anybody without a mask on. Like, if I do, I'm like, wow, look at you.
Give him a tip of the hat.
Yeah, even at Wegmans, where they've already kind of made it abundantly clear of like, yeah, we don't think we can enforce this, so we're not going to. We want you to. We're going to put a sign up, but if you come and like, go Karen on somebody for not wearing a mask, we're not going to do anything about it. All right, cool. Even in Wegmans, I don't see anybody without a mask on. So we've had well in excess of 90% of compliance with masks, and that's not my opinion. That's looking at the actual data and the surveys that have been done. And in that time frame, cases went up, went down, went way up, and then came way down. What did we do? And so then they came out like 2 masks. Like, we haven't even established correlation, and you are jumping to causation. You haven't even shown that there's been a corresponding drop in cases when masks happen, but you're already claiming that it's because of masks. This is nuts. Same with school. Look at Florida versus New York. You want to know a fun story? They have very similar curves. Florida's doing better, but they have very similar curves when we have everything shut down and they have nothing. North Dakota and South Dakota is another great example. One has full on, everything is closed. The other one is, be smart. Almost the exact same curve everywhere you go. So the problem is, the question should not be, hey, can we lift the restrictions when we get herd immunity? Here's my honest question for anybody. What good are the restrictions doing? What measurable evidence do you have that says closing businesses, closing schools, wearing masks, and social distancing is having any real-world impact on the spread of COVID-19?
They don't, but it feels good.
Right. But instead, you just want credit for trying, which, okay, cool. But let's dial it down because it's not happening. It's not working anywhere in the world that you're doing this. It's just not. Think about how different life would have been, and this is something I was discussing this over the weekend. Let's go back to last March. And let's just say initially we panicked, but instead of coming out with a mask mandate, and you and I discussed this on the show at that point, what if they just said, all right, here's what they're going to be. There's apparently a relationship with vitamin D deficiency and higher rates of infection, which would make sense as a coronavirus, as a SARS-type virus, that would be a correlating indicator. There's no real downside to having everybody take vitamin D supplements. So especially if you live in an area of the country that doesn't get a ton of sun this time of year, i.e. the Northeast, go out and buy vitamin D and start taking it. We can't stress this enough. Everybody should be taking vitamin D. Go take vitamin D. Yes, there would have been a run on vitamin D. All right, life goes on. So you get vitamin D. It's just be smart about it. Take 1 or 2 a day and keep doing that, and that'll be. And now, anybody over the age of 65, let's go ahead and start treating you with hydroxychloroquine prophylactically. Even if we're not going to fully recommend it, we're going to allow doctors to do it because there's some data from all around the world indicating that it's actually having a pretty good effect, not necessarily as a prophylactic, but in the event that you get it, you're guaranteed to take the hydroxychloroquine on day 1 or day 2 of your infection, thereby leading to better results. If we had done those 2 things, how different would life be right now?
Yeah, it'd be totally different.
It would be night and day. Yeah. The death counts would all be way lower. The infection rates would be lower, and it would have been fine. I don't care about the number of cases. I think it's the most irrelevant statistic known to man. The same reason I don't care about how many people get the flu every year or how many people get whatever other virus every year. I care about how many people are dying from the virus. How many people are dying that would not have died without this virus. Sorry, but if you had stage 4 liver cancer and you died in June instead of July, I don't mean to sound like cold-hearted, but it's not something I'm going to shape public policy on, is preventing that. So instead, it's how many actual deaths. And the reality is, when you take into account suicides, accidental deaths, overdoses, preventable deaths from people not getting treatment, we've done so much harm. And I'm not saying that vitamin D and hydroxychloroquine would have stopped all of it. It wouldn't have. But there was a time we understood you can't stop an aerosol virus from spreading. Not in any meaningful way. You can't. Once it's in there, once it's on the ground, it is going to find hosts and it is going to spread. Because reality is the social distancing shouldn't have been 6 feet. If you're serious, all right, if you're not virtue signaling and you really want to do this, masks will work. You need an N95 that's been properly fitted to you that you've got to change out the filter on regularly. Number 2, if you're going to wear a regular mask, it's not, no matter what you do, going to have a huge impact. But if you're not changing it out every 20 minutes, it's actually making things worse. And you have to keep it sterile. So you can't throw it on the passenger seat of your car. You can't throw it in your pocket. You can't set it down on a bar while you sit down to have a drink. Nope. All of that thing corrupts the mask, makes it worse.
Well, all these places have biohazard trash things for masks now. So
right.
No, they don't.
Oh, yeah. No, I've never seen one. And you know where I see them instead? All over the parking lot of everywhere I go. Awesome. We're doing a great job, everybody.
No, like I said, the masks, again, they were literally, I feel like, just... They were going to try to ask for a sacrifice of everybody, and that's what they've been doing for a year. You know, it's all been these things. Oh, just do a mask. It's there's no harm. There's no fire. It's just 2 weeks, right? It was like, oh, we're just 2 weeks to flatten that curve. Like, oh, it's just going to be one holiday, one Easter, one Christmas. One holiday. Just skip it for the better of all human kind, whatever. Like, just take the vaccine. These are all sacrifices by people that seemingly for a thing that doesn't really matter. Like it matters to, we know who it matters to, people over the age of 75, and yet we culled basically our whole world for everybody minus the people that were 75. So, like, I hope humanity just is again, this catalyst that ends the lockdowns, because the devastation that's been caused by the lockdowns is going to last for decades. And we're only going to be able to count the numbers in hindsight, and they're going to be way higher than anything we possibly could have dealt with through COVID here in 2021.
For sure. And not only that, it's not just masks. Social distancing at 6 feet is completely arbitrary. The actual number is like 25 feet.
Especially with a mask.
Right. If you're not staying 25 feet away from somebody, you're not doing anything. It's not actually helping. It's not in any meaningful way. And I mean, I'll draw back to this example again. It's like wearing a bicycle helmet when you're buckled into a car. Like, is it safer? I guess, but it's so low on the list of things that are going to prevent it. Just because you have the bike helmet on doesn't mean that you should go get hammered and drive 90. It's still not smart. Like, you can't stop some of this, but it's all just, well, look at how good I am, and I'm a good person because I always wear a mask and socially distance. Great. I don't. Listen, I wear a mask whenever I'm required to. I don't go and argue with anybody. Fine, I'll put the mask on. I know how dumb it is. I don't care. I think it's idiotic. It's all of these things in succession that everybody keeps doubling down on as soon as it comes out, and we no longer even ask questions. That is what is so bad.
How did people just not, all just flip it when the 2 mask thing came out? Like, that should have been
the funniest
that
thing
should have
I've
been
ever
the
seen
thing,
in
right?
my
Like,
entire life.
no, we're going to go to 2 masks. So he basically admitted that 1 mask didn't work because we need a second mask, but everybody just bought in anany. Like, 2 masks.
Did you see what they did for the science behind 2 masks?
I don't want to know.
They put them on dummies. There's not even, let alone real world actual human trials. There weren't even laboratory trials of human beings when they came out with like, science. See, here we go. But all of this stuff is, listen, you want to know why I'm skeptical about taking a vaccine? Because there's no reason for this vaccine to exist. This didn't need to get to this point to begin with. And it's not as if, well, obviously we know that now. No, that is what the data indicated all along the way if you cared to look at it. Yeah. It was there.
Most of this stuff that's coming to realization now from a lot of these people was known in May. Yeah, it was known in May.
It was,
and some people knew before then, but like most people had kind of digested everything, had kind of like taken a step back and was like, okay, wait a minute, this is not exactly what we were signed up for here, and things are way different, and the policies never changed, even though the data was significantly different than it was in early March specifically, and through early April. So. Again,
it's not a compliance issue. People are complying. People are doing what you're asking them to do. Yeah. It's the simple reality of you are asking everybody to do a rain dance, and then when it doesn't rain, you're blaming the 1 guy out of 10 that sat it out. No, it's because you don't understand what's actually causing this. That's the problem. Yeah. And if you don't understand what's actually causing it, all you're doing is actually creating more harm in your rush to be the one that says, I solved the problem. And it's so awful for so many people. Look, it's worse too. Like, never mind the economic destruction in the short run of these businesses and everything else. The COVID we went from $20 trillion to $30 trillion of debt in 1 year as a country. We cannot pay that back. It is not possible. It's not in reality. It's so damaging. It's hard to actually fathom how many people are going to suffer as a result of this. And again, going back to May, yes, there was one study that came out that said, see, kids spread it just as easily as adults, and I got that shoved into my face probably about 1,000 times. And I laughed. I said, no, I've read it. Did you? Well, no. Yeah, I read the article. No. Did you read the study? Well, no, I don't need to read the study. I'm not a scientist. Oh, okay, cool. So you're just going to shove your kid to stay home and support that, even though the data that this is based on is so flawed that there is no way it could have ever been falsified. They have no way of knowing if this is right. It's just a theory. But here's 6 other studies that all show kids don't spread it. I don't have time for your nonsense. Right. No, my science is fake. Yours is real. Got it. No, it's if you looked at all of the data, and I'm not telling you anything would have been a guarantee. I'm telling you what the evidence indicated as a percentage, and if you would have played the odds, if you would have played the 99% rule instead of the 1% exception from May, we would have had everybody taking vitamin D. We would have had proper hand washing going on. We would have had older people on hydroxychloroquine, even in a prophylactically, or even if we weren't going to do that, at least not outlawed it, at least not banned its use in multiple states as a drug to do this. I'm not making up this data. You have to look at the data outside of America where doctors actually treated with it. It made a huge impact. Maybe it's all correlation. Maybe there is absolutely no causation. Be a hell of a coincidence with a lot of consistency. Either way, there's been all these other drugs that have proven, I don't want to say proven, that have indicated some success in helping against COVID-19. We ignored all of them. And now we have a vaccine that doesn't even prevent the spread, and people are championing that as the reason we're at that cases are down 70% because 10% of the people got a vaccine that doesn't block you from spreading the virus. That's why cases are down.
I did see Pfizer release a statement saying that they thought that there was 89.4% effective rate of keeping it from spreading in their vaccine. I think that was yesterday or today.
That was in Israel, and it's the funniest. Again, this is not science. This is such nonsense. It's crazy, but as soon as you like, well, Pfizer said so, everybody's like, oh, okay, yeah, it's science. And it's just confirmation bias. If you came out, now the problem is this. If I asked you last February, not you, because I know where you stand, but if I asked the average person out there and said, all right, here's what we're going to do to fight COVID-19. We're going to basically shut down bars and restaurants or limit their capacity for the next at least 13, maybe 18 months. We're also going to make everybody just work from home, and we're going to keep most schools in the country at least partially closed for at least this whole school year, into the spring at a minimum. And we're probably still going to have